Which part of the respiratory system is responsible for gas exchange? Option A bronchi, option B alveoli, option C trachea, option D larynx. The correct answer is option B alveoli. Alveoli are tiny air sacs in the lungs where oxygen diffuses into blood and carbon dioxide diffuses out. The next question. Which enzyme converts carbon dioxide into bicarbonate in red blood cells? Option A lipase, option B amylase, option C carbonic anhydrase, option D pepsin. The correct answer is option C carbonic anhydrase. Carbonic anhydrase catalyzes the reversible reaction between carbon dioxide and water to form carbonic acid, which helps maintain blood pH. What is the normal respiratory rate in a healthy adult at rest? Option A 10 to 12 breaths per minute, option B 12 to 20 breaths per minute, option C 20 to 30 breaths per minute, option D 20 to 35 breaths per minute. The correct answer is option B 12 to 20 breaths per minute. The normal respiratory rate in adults is between 12 and 20 breaths per minute, ensuring adequate gas exchange. Which structure prevent food from entering the trachea? Option A vocal cords, option B uvula, option C epiglottis, option D soft palate. The correct answer is option C epiglottis. The epiglottis is a flap of cartilage that converts the trachea during swallowing to prevent aspiration of food or liquids. The next question. In which part of the brain is the respiratory center located? Option A cerebrum, option B cerebellum, option C medulla oblongata, option D thalamus. The correct answer is option C medulla oblongata. The medulla oblongata on pons regulate the rate and depth of breathing by responding to changes in blood gas levels. Next question. What happens to the diaphragm during inspiration? Option A relaxes and move upward. Option B contract and moves downward. Option C relaxes and move downward. Option D contracts and move upward. The correct answer is option B contract and move downward. During inhalation, the diaphragm contracts and flattens, increasing thoracic volume and drawing air into the lungs. The total lung capacity is the sum of option A tidal volume plus residual volume, option B vital capacity plus residual volume, option C inspiratory reserve and expiratory reserve, option D tidal volume plus vital capacity. The correct answer is option B vital capacity residual volume. Total lung capacity represents the maximum amount of air in the lungs can hold, including air that remains after forced exhalation. Which condition is characterized by destruction of alveolar walls? Option A asthma, option B emphysema, option C tuberculosis, option D pneumonia. The correct answer is option B emphysema. Emphysema involves damage to the alveoli leading to reduced surface area for gas exchange and shortness of breath. Next question. Which gas primarily stimulate the respiratory center? Option A oxygen, option B carbon dioxide, option C nitrogen, option D hydrogen. The correct answer is option B carbon dioxide. Increased carbon dioxide levels in the blood stimulate chemoreceptors, which signals the medulla oblongata to increase breathing rate. Which of the following condition is caused by Mycobacterium tuberculosis? Option A asthma, option B COPD, option C tuberculosis, option D pneumothorax. The correct answer is option C tuberculosis. Tuberculosis is a chronic bacterial infection caused by Mycobacterium tuberculosis, affecting mainly the lungs. The term apnea refers to option A rapid breathing, option B difficulty in breathing, option C temporary cessation of breathing, option D painful breathing. The correct answer is option C temporary cessation of breathing. Apnea is a temporary pause in breathing commonly seen in sleep apnea syndromes. The next question. What is the normal tidal volume in healthy adult? Option A 200 ml, option B 300 ml, option C 500 ml, option D 700 ml. The correct answer is option C 500 ml. Tidal volume represents the amount of air inhaled or exhaled in a normal breath, approximately 500 ml in adults. What happened to alveolar pressure during inspiration? Option A increases, option B decreases, option C remains constant, option D become equal to atmospheric pressure. The correct answer is option B decreases. During inspiration, thoracic expansion reduces alveolar pressure, allowing air to move into the lungs. Next question. Which structure carries air into each lung? Option A trachea, option B bronchi, option C bronchioles, option D alveoli. The correct answer is option B bronchi. The trachea divides into right and left bronchi. Each enters its respective lung to distribute air. What is the main component of respiratory membrane? Option A, alveolar wall and capillary wall. Option B, tracheal cartilage. Option C, bronchial lining. Option D, pleural membrane. The correct answer is option A, alveolar wall and capillary wall. The respiratory membrane consists of alveolar and capillary walls where gas exchange occurs. Next question. Which of the following is a restrictive lung disease? Option A, emphysema. Option B, asthma. Option C, pulmonary fibrosis. Option D, bronchitis. The correct answer is option C, pulmonary fibrosis. Pulmonary fibrosis causes shifting of lung tissue, reducing lung expansion and compliance. Next question. The oxygen carrying capacity of blood depends mainly on option A, plasma proteins, option B, RBC, option C, hemoglobin concentration, option D, WBC. The correct answer is option C, hemoglobin concentration. Hemoglobin binds oxygen in red blood cells, determining how much oxygen can be transported. Next question. What is the function of cilia in the respiratory tract? Option A, gas exchange. Option B, trap dust and move mucus. Option C, produce mucus. Option D, filter carbon dioxide. The correct answer is option B, trap dust and move mucus. Cilia sweep mucus and trapped particles upward to keep airway clean. The voice is produced by vibration of option A, glottis. Option B, vocal cords. Option C, laryngeal cartilage. Option D, soft palate. The correct answer is option B, vocal cords. The vocal cords in the larynx vibrate as air passes through, producing sound. Next question. The partial pressure of oxygen in alveoli is approximately option A, 40 mmHg, option B, 60 mmHg, option C, 100 mmHg, option D, 120 mmHg. The correct answer is option C, 100 mmHg. The alveolar oxygen partial pressure is about 100 mm of Hg, ensuring efficient diffusion into pulmonary capillaries. Next question. The exchange of gases between tissues and blood is known as option A, external respiration, option B, internal respiration, option C, cellular respiration, option D, pulmonary ventilation. The correct answer is option B, internal respiration. Internal respiration refers to exchange of oxygen and carbon dioxide between body tissues and the blood. Next question. The nasal septum divides the nasal cavity into option A, upper and lower house, option B, left and right house, option C, front and back house, option D, superior and inferior house. The correct answer is option B, left and right house. The nasal septum is a partition made up of bone and cartilage that separates the nasal cavity into two halves. Which of the following occurs during expiration? Option A, diaphragm contract, option B, thoracic cavity expands, option C, lung recoil, option D, air pressure in lungs decreases. The correct answer is option C, lung recoil. During exhalation, the diaphragm relaxes, lung recoil, and air is pushed out as lung pressure rises. Which of the following disease is caused by long-term exposure to coal dust? Option A, asbestosis, option B, silicosis, option C, pneumoconiosis, option D, byssinosis. The correct answer is option C, pneumoconiosis. Pneumoconiosis is a chronic occupational lung disease caused by inhalation of coal dust particles. Which nerve supplies the diaphragm? Option A, vagus nerve, option C, pharynx nerve, option C, glossopharyngeal nerve, option D, accessory nerve. The correct answer is option B, pharynx nerve. The pharynx nerve originates from cervical nerves 3 and 3 and controls diaphragm movement for breathing. Thank you. The presence of air in the pleural cavity is called option A, hemothorax, option B, pneumothorax, option C, hydrothorax, option D, emphysema. The correct answer is option B, pneumothorax. Pneumothorax occurs when air enters the pleural cavity, causing partial or total lung collapse. The next question, which respiratory volume cannot be measured directly by a spirometer? Option A, tidal volume, option B, vital capacity, option C, residual volume, option D, expiratory reserve volume. The correct answer is option C, residual volume. Residual volume is the air remaining in the lungs after maximal exhalation and cannot be measured directly by spirometry. The main muscle involved in quiet breathing is the option A intercostal muscle, option A diaphragm, option C abdominal muscle, option D pectoral muscle. The correct answer is option B diaphragm. The diaphragm is the primary muscle of respiration responsible for normal quiet breathing. The next question. The pulmonary artery carries option A oxygenated blood to the lungs, option B deoxygenated blood to the lungs, oxygenated blood to the heart, deoxygenated blood to the heart. The correct answer is option B deoxygenated blood to the lung. The pulmonary artery carries deoxygenated blood from the right ventricle to lungs for oxygenation. The pulmonary vein carry option A deoxygenated blood to the heart, option B oxygenated blood to the heart, oxygenated blood to the lungs, deoxygenated blood to the lungs. The correct answer is oxygenated blood to the heart. Pulmonary veins transport oxygenated red blood from the lung to the left atrium of heart. Which condition involves accumulation of fluid in the alveoli? Option A pleurisy, option B pulmonary edema, option C asthma, option D pneumothorax. The correct answer is option B pulmonary edema. Pulmonary edema is the accumulation of fluid in alveoli leading to impaired gas exchange and breathlessness. Which of the following increases the oxygen carrying capacity of blood? Option A high carbon dioxide, option B low hemoglobin, option C increased hemoglobin, option D low red blood cells. The correct answer is option C increased hemoglobin. A higher hemoglobin concentration allows more oxygen to be transported in the blood. The next question. The trachea is supported by option A elastic ligaments, option B smooth muscles, option C C-shaped cartilage rings, option D bony structures. The correct answer is option C C-shaped cartilage rings. The trachea contains C-shaped hyaline cartilage rings to maintain its patency during breathing. The voice pitch is mainly determined by option A air pressure in the lungs, option B length and tension of vocal cords, option C position of the epiglottis, option D movement of the lung. The correct answer is B length and tension of vocal cords. The higher the tension in the vocal cords, the higher the pitch of the sound produced. Which of the following is an obstructive lung disease? Option A asthma, option B pulmonary fibrosis, option C sarcoidosis, option D atelectasis. The correct answer is option A asthma. Asthma is characterized by airway obstruction due to inflammation and bronchospasm. The next question. The exchange of gases in the lungs occur mainly by option A active transport, option B osmosis, option C diffusion, option D filtration. The correct answer is option C diffusion. Gases move across the alveolar membrane by diffusion from areas of high to low partial pressure. The next question. The normal inspiratory reserve volume in an adult is approximately option A 1000 ml, option B 1500 ml, option C 3000 ml, option D 5000 ml. The correct answer is option C 3000 ml. Inspiratory reserve volume is the additional air that can be inhaled after normal inspiration, about 3000 ml. The pleural cavity is located between option A lungs and diaphragm, option B visceral and parietal pleura, option C trachea and bronchi, option D ribs and intercostal muscles. The correct answer is option B visceral and parietal pleura. The pleural cavity lies between the visceral and parietal pleura and contains lubricating fluid. The nasal hairs function mainly to option A produce mucus, option B trap dust and foreign particles, option C cool the inhaled air, option D increased surface area. The correct answer is option B trap dust and foreign particles. Nasal hairs prevent dust and microbes from entering deeper parts of the respiratory tract. Next question. The respiratory pigment in human is option A hemocyanin, option B hemoglobin, chlorochlorine, option D myoglobin. The correct answer is option B hemoglobin. Hemoglobin in red blood cells binds to oxygen and facilitates its transport throughout the body. The next question. What is the major function of the respiratory system? Option A transport of nutrients, option B exchange of gases, option C excretion of wastage, option D production of hormones. Correct answer is option B exchange of gases. The main function of the respiratory system is the exchange of oxygen and carbon dioxide between body and the environment. The next question. Which of the following condition is commonly known as collapsed lung? Option A asthma, option B pneumothorax, option C emphysema, option D bronchitis. The correct answer is option B, pneumothorax. Pneumothorax occur when air enters the pleural cavity, leading to partial or complete collapse of the lung. The next question. Oxygen binds to which part of the hemoglobin molecule? Option A, iron in the heme group. Option B, globin protein. Option C, carbon dioxide side. Option D, carboxyl group. The correct answer is option A, iron in the heme group. Each heme group in hemoglobin contains an iron atom that binds reversibly with one oxygen molecule. The next question. The term hyperventilation refers to option A, slow breathing. Option B, deep and rapid breathing. Option C, shallow breathing. Option D, absence of breathing. The correct answer is option B, deep and rapid breathing. Hyperventilation is characterized by rapid deep breathing that decreases carbon dioxide level in the blood. What is the primary stimulus for breathing under normal conditions? Option A, oxygen concentration. Option B, carbon dioxide concentration. Option C, blood pressure. Option D, temperature. The correct answer is option B, carbon dioxide concentration. Elevated carbon dioxide levels stimulate chemoreceptors to trigger an increase in the rate and depth of breathing. Which part of the respiratory system acts as a resonating chamber for sound? Option A, pharynx. Option B, nasal cavity. Option C, larynx. Option D, trachea. The correct answer is option B, nasal cavity. The nasal cavity acts as a resonating chamber that enhances the quality of sound producing in the larynx. The normal vital capacity in an adult is approximately option A, 1000 ml, option B, 2000 ml, option C, 4800 ml, option D, 7000 ml. The correct answer is option C, 4800 ml. Vital capacity is the maximum amount of air that can be exhaled after a deep inspiration, around 4800 ml for adults. Which lung is smaller and has two lobes? Option A, right. Option B, left lung. Option C, both lungs equal. Option D, depends on age. The correct answer is option B, left lung. The left lung has two lobes and a cardiac nose to accommodate the heart, making it smaller than right lung. The next question. Which structure divided into primary bronchi? Option A, pharynx. Option B, larynx. Option C, trachea. Option D, alveoli. The correct answer is option C, trachea. The trachea bifurcate into right and left primary bronchi at the level of fifth thoracic vertebra. Next question. The diaphragm is composed of option A, skeletal muscle, option B, smooth muscle, option D, cardiac muscle, option D, elastic tissue. The correct answer is option A, skeletal muscle. The diaphragm is a dome-shaped skeletal muscle that contracts during inspiration and relaxes during expiration. Thank you all. Which of the following is an example of lower respiratory tract infection? Option A, sinusitis, option B, laryngitis, option C, bronchitis, option D, rhinitis. The correct answer is option C, bronchitis. Bronchitis affects the bronchi of the lower respiratory tract and causes inflammation and mucus buildup. The exchange of gases between lungs and blood occurs through option A, osmosis, option B, diffusion, option C, active transport, option D, filtration. The correct answer is option B, diffusion. Gas exchange between alveoli and capillaries occur by simple diffusion along concentration gradients. Which of the following conditions is caused by inflammation of the larynx? Option A, laryngitis, option B, bronchitis, option C, asthma, option D, pharyngitis. The correct answer is option A, laryngitis. Laryngitis causes harshness and loss of voice due to inflammation of the laryngeal mucosa. The respiratory center is influenced by option A, blood pressure, option B, pH of blood, option C, glucose level, option D, temperature. The correct answer is option B, pH of blood. The medulla respiratory center responds to changes in the blood pH caused by carbon dioxide accumulation. Next question. Which cells secrete mucus in the respiratory tract? Option A, ciliated cells, option B, globular cells, option C, alveolar cells, option D, endothelial cells. The correct answer is option B, globular cells. Globular cells in the respiratory epithelium secrete mucus to trap dust and microbes. The next question. Which of the following is the site of voice production? Option A, larynx, option B, trachea, option C, pharynx, option D, bronchi. The correct answer is option A, larynx. The larynx contains vocal cords that vibrate during exhalation, producing sound. The larynx contains vocal cords that vibrate during exhalation, producing sound. Which of the following prevent friction between the lungs and thoracic wall? Option A, pleural fluid. Option B, synovial fluid. Option C, mucus. Option D, pericardial fluid. The correct answer is option A, pleural fluid. Pleural fluid in the pleural cavity reduces friction during breathing movements. The next question. What is the main function of epiglottis? Option A, produce sound. Option B, close the trachea during swallowing. Option C, filter air. Option D, warm air. The correct answer is option B, close the trachea during swallowing. The epiglottis prevent fluid or liquid from entering the airway while swallowing. Which process occurs when oxygen moves from alveoli into blood? Option A, active transport. Option B, diffusion. Option C, filtration. Option D, osmosis. The correct answer is option B, diffusion. Oxygen diffuses from the alveoli high concentration to capillary blood low concentration. Which respiratory disorder is characterized by narrowing of airway due to inflammation and mucus? Option A, asthma. Option B, tuberculosis. Option C, pneumonia. Option D, bronchiectasis. The correct answer is option A, asthma. Asthma is a chronic condition with airway narrowing due to inflammation of mucus secretion. The term hemothorax refers to option A, air in pleural cavity. Option B, blood in pleural cavity. Option C, pus in pleural cavity. Option D, fluid in pleural cavity. The correct answer is option B, blood in pleural cavity. Hemothorax is the accumulation of blood between the pleural membranes, often after trauma. The main stimulus for respiration in healthy individuals is option A, high oxygen. Option B, high carbon dioxide. Option C, low nitrogen. Option D, high bicarbonate. The correct answer is option B, high carbon dioxide. Chemoreceptors detect high carbon dioxide levels and stimulate the medulla to increase respiratory rate. The lungs receive oxygenated blood from option A, pulmonary arteries. Option B, pulmonary veins. Option C, bronchial arteries. D, aorta only. The correct answer is option C, bronchial arteries. Bronchial arteries supply oxygenated blood to lung tissue for nourishment. Bronchial arteries supply oxygenated blood to lung tissue for nourishment. The trachea is lined by which type of epithelium? Option A, simple squamous. Option B, ciliated pseudostratified columnar. Option C, simple cuboidal. Option D, transitional. The correct answer is option B, ciliated pseudostratified columnar. This specialized epithelium traps and moves particles out of the airway using cilia and mucus. The next question. In which condition do alveoli become enlarged and lose elasticity? Option A, asthma. Option B, emphysema. Option C, pneumonia. Option D, tuberculosis. The correct answer is option B, emphysema. Emphysema causes destruction of alveolar walls, reducing gas exchange surface and elasticity. The next question. The conducting zone of the respiratory system includes option A, alveoli. Option B, bronchi and trachea. Option C, capillaries. Option D, blood vessels. The correct answer is option B, bronchi and trachea. The conducting zone includes airways that transport air but do not participate in gas exchange. The next question. The respiratory center is located in the option A, cerebellum. Option B, cerebrum. Option C, medulla oblongata. Option D, thalamus. The correct answer is option C, medulla oblongata. The medulla oblongata regulates respiratory rhythm and rate automatically. Medulla oblongata regulates respiratory rhythm and rate automatically. The process of moving air into and out of the lungs is called option A, ventilation. Option B, diffusion. Option C, perfusion. Option D, oxidation. The correct answer is option A, ventilation. Ventilation involves inhalation and exhalation to facilitate gas exchange. Ventilation involves inhalation and exhalation to facilitate gas exchange. The left lung contains option A, 3 lobes. Option B, 2 lobes. Option C, 4 lobes. Option D, 1 lobe. The correct answer is option B, 2 lobes. The left lung has only 2 lobes, superior and inferior, due to space for the heart. The next question. Which of the following is a sign of respiratory distress? Option A, regular breathing. Option B, pink skin. Option C, use of accessory muscles. Option D, normal pitch. The correct answer is option C, use of accessory muscle. Accessory muscle use indicates labored breathing and difficulty maintaining adequate ventilation. Next question. Which structure filters, warms and moistens air entering the respiratory system? Option A, trachea. Option B, nasal cavity. Option C, bronchus. Option D, larynx. The correct answer is option B, nasal cavity. The nasal cavity is lined with mucous membranes and cilia that traps dust, warm and moisten income air before it reaches the lungs. The next question. The respiratory center that controls the depth of breathing is located in the option A, cerebellum. Option B, medulla oblongata. Option C, hypothalamus. Option D, pons. The correct answer is option D, pons. The pons regulates the depth and smooth transition of breathing, working with the medullary centers. The next question. Which of the following conditions is characterized by recurrent airway obstruction and wheezing? Option A, asthma. Option B, pneumonia. Option C, tuberculosis. Option D, emphysema. The correct answer is option A, asthma. Asthma involves reversible airway obstruction due to inflammation and muscle spasm, leading to wheezing, shortness of breath. The pleural fluid functions to option A, reduce friction between pleural membranes. Option B, supply oxygen to the lungs. Option C, absorb carbon dioxide. Option D, protect lung from infection. The correct answer is option A, reduce friction between pleural membrane. Pleural fluid act as a lubricant between the visceral and parietal pleura, allowing smooth lung movement during breathing. Which structure connects the larynx to bronchi? Option A, pharynx. Option B, trachea. Option C, alveoli. Option D, bronchioles. The correct answer is option B, trachea. The trachea or windpipe connects the larynx to bronchi and serve as the main airway passage to the lungs. Thank you all.